It is my belief, and we've done a study to demonstrate, that whole body skeletal scintigraphy is rarely helpful in the diagnosis of the causes of pain causing multi-limb lameness in mature sports horses. It unquestionably has a valuable role in the investigation of racehorses with a high prevalence of stress-related bone injury. It has a use when we cannot identify the source or sources of pain using diagnostic anesthesia. And it has a use when we have localized the source of pain, but cannot, by radiography and ultrasonography, define necessarily the causes of pain that marry together with the clinical symptoms. If we just use it as a screening tool, we will find quite frequently areas of increased radiopharmaceutical uptake, such as in the summits of the spinous processes, as in this image on the right, which are not necessarily of clinical significance. Increased radiopharmaceutical uptake does not necessarily equate with pain, and certainly not pain causing lameness or compromise in performance. Ultrasonography is highly user sensitive, and we have to be aware that the detection of structural abnormality does not necessarily equate with current pain. It may reflect an old injury, which may not be of current significance. It is time-consuming and expensive to acquire magnetic resonance images, and therefore these scans need to be targeted based on previous identification of the source or sources of pain. Computed tomography enables us to look at multiple areas relatively quickly in very high detail. But this produces interpretation difficulties or challenges because it may unveil many lesions, but how do we determine their clinical significance? And that's opening a real can of worms. So during the investigation, I think it's important to determine what are the most important problems related to the owner's problems and for the horse's welfare and longevity as either a sports horse or a leisure horse. It's important to recognise that a low-grade right forelimb lameness, seen only on the lunge on a hard surface, may be of absolutely no relevance to the owner's complaint of lack of hind limb power and difficulties in sustaining canter. And we can see the horse on the right has got a very croup high canter, which is on the forehand. And this was related to bilateral proximal suspensory desmopathy in the hind limbs. The horse did show a subtle right forelimb lameness on the lunge on a firm surface, but this was irrelevant to the horse's presenting problem. So we have to relate our clinical observations with the history. So, for example, a low-grade unilateral lameness associated with tarsometatarsal joint pain may be of no relevance to the rider's problem of bucking going into canter, as seen on the right, which was associated with lumbosacroiliac joint region pain. We also need to be aware that owners are frequently lacking in awareness of the potential welfare problems for a horse. A one-horse rider who is not aware of how a normal horse should move, should appear, should feel and behave, may be completely ignorant of the amount of discomfort a horse is experiencing. And although they may have come round to recognizing the presence of a problem which merits investigation, an owner may be in denial of the potential severity of the problems, expecting a quick fix, when actually a quick fix is just not possible.